I need to share something that's weighed on me for years, and I already know the moment these words leave my mouth, some of my colleagues are going to be genuinely upset with me. But after more than 2 decades practicing medicine, after watching what actually happens to people who follow every single recommendation handed to them, I simply can't stay quiet any longer. I'm Dr. William, and here's the uncomfortable truth nobody wants to admit. Sometimes the worst thing you can do for your health is get too many tests, especially once you cross 60 or 65. Now, I can already hear some of you thinking, wait, isn't this doctor supposed to be telling me to get checked for everything? Isn't prevention the entire point of modern medicine? And yes, that's exactly the message we've all absorbed for years. Catch it early. Find it before it becomes a real problem. Stay on top of everything. That's what every commercial and every checkup reminder tells us. But what if that message conveniently leaves out the most important part of the story, the part about what actually happens after you find something? Because here's what nobody mentions in those glossy screening advertisements. Once you find something, anything at all, even something that would never actually harm you, the wheels start turning. And sometimes those wheels roll right over your quality of life. So today, I want to walk you through 4 medical tests that I've watched cause more problems than they solve, particularly for people over 60. I'm not doing this to scare you away from doctors. I'm doing this so you understand exactly what you're signing up for before agreeing to every test that gets offered to you. Before we get into specifics, though, you need to understand something that fundamentally changed how I practice medicine, something called the cascade effect. And once you truly see it, you can't unsee it again. Here's how it plays out. You go in for a screening test feeling perfectly fine, living your normal life, doing your usual routine. The test comes back showing something, maybe a spot, maybe a shadow, maybe a number that's slightly off. That something might be completely harmless, sitting there quietly for 20 years and would have sat there for 20 more without ever bothering you. But here's the problem. The doctor sees it, and now they have to act on it. Because what if they don't? And what if it turns out serious? So you get sent to a specialist. That specialist orders another, more detailed test. That test shows the same ambiguous thing, still unclear. Now we're discussing a biopsy, or a procedure, or possibly even surgery, and every single one of those steps carries real risk. Infection, bleeding, complications, anxiety, lost time. And here's the kicker. 9 times out of 10, once you reach the end of that whole process, you discover it was nothing, something that was never going to hurt you in the first place. But by then, you've endured months of worry, undergone procedures, maybe suffered complications, and ended up worse off than when you started, all triggered by a single test you took while feeling completely fine. That's the cascade, and it always begins with one test you probably never needed in the first place. So let's talk about the first test I see triggering this exact problem over and over again. And this one is tricky, precisely because it sounds so smart, so modern, so genuinely preventive. I'm talking about whole body scans, full body MRIs or CT scans promising to check everything at once. You've probably seen the advertisements. Come in, get scanned head to toe, catch anything before it becomes a real problem. It sounds incredible, doesn't it? Like finally having a complete picture of everything happening inside your body. And honestly, I understand the appeal completely. The idea of total knowledge, of total control, is enormously tempting. But here's what actually happens in reality. Say you're 65, feeling great, staying active, showing no symptoms of anything at all. You decide to get one of these scans just to be cautious. You lie in the machine for 30 minutes, and a couple of days later, your results arrive. And right there in the report, the radiologist notes something. A small lung nodule, 3 millimeters, roughly the size of a pencil eraser, or maybe a kidney cyst, or a spot on your liver. The report recommends follow-up imaging in 3 to 6 months. How do you feel in that exact moment? You walked in feeling perfectly healthy and walked out being told something inside you now needs constant watching. Suddenly, every deep breath makes you wonder about that lung nodule. Every twinge in your side brings that kidney cyst to mind. 3 months later, you're back for another scan. Maybe it's still there, maybe slightly bigger, hard to say for certain. The radiologist suggests seeing a specialist who, being thorough, recommends a biopsy. And a biopsy is far from nothing. It means anesthesia, a needle inserted into your lung or kidney or wherever this thing sits, real risk of infection and bleeding. Here's what research actually shows. When healthy people over 60 get scanned, doctors find something unusual in nearly everybody. We're talking 90 to 95% of people. Little spots, little cysts, little shadows, medically termed incidental findings, things stumbled upon by accident. The vast majority will never cause a single problem. They're simply part of having a body that's existed for 6 or 7 decades, essentially wrinkles on the inside. But once discovered, we can't just ignore them, and that's exactly when the cascade begins. Research following people who underwent these whole-body scans found something striking. Scanned individuals didn't live any longer than those who skipped scanning, and they didn't avoid a single disease either. What they did experience was significantly higher rates of anxiety, depression, and unnecessary procedures. The scans didn't make anyone healthier. They made people sicker. So what should you do instead? I'm certainly not suggesting you ignore your health entirely. I'm suggesting you focus on the right things. Instead of chasing a picture of your insides, pay attention to how your body actually functions. Can you climb 2 flights of stairs without getting winded? Can you rise from a chair without using your hands? How's your balance, your sleep? These functional measures tell us far more about genuine health than any scan ever could. If you want a genuine health checkup, sit down with a doctor willing to spend real time with you. Someone who reviews every medication you're taking, because I guarantee at least one is likely doing more harm than good. Someone who discusses your diet, activity level, and social connections, because those ordinary, everyday things actually determine how healthy you truly are. A scan searches for problems that might not even exist. A functional assessment optimizes the health you already have, and that distinction matters enormously. Now let's move to the second test, one touching a fear nearly all of us carry as we age: getting a brain MRI for minor memory lapses. Picture this scenario. You're in your mid-70s and occasionally can't recall an actor's name, or you walk into a room and forget why you went there. Completely normal occurrences as we age. But maybe your children are worried, having heard about Alzheimer's, and they push you toward a brain scan just to check. I understand that fear deeply. Nobody wants to contemplate losing their memory, losing themselves. But getting a brain MRI for mild forgetfulness is almost never helpful and frequently harmful. Because here's what unfolds. You get the MRI, and days later you're sitting with your doctor reading a report full of phrases like mild cerebral atrophy, age-related changes, white matter lesions, small vessel disease. These words sound absolutely terrifying, like your brain is deteriorating. But the truth is, these findings are completely normal for someone in their 70s, describing what nearly every brain looks like at that age, much like scanning skin and being shocked to find wrinkles and age spots. Of course, it shows that that's simply what skin looks like at 75. The problem is, these medical terms don't sound normal. They sound like disease. And suddenly, you're convinced you have brain damage, convinced Alzheimer's is right around the corner, even though you're perfectly fine. Studies show that scanning healthy brains over 75 reveals abnormal-looking findings in more than 90% of cases, yet most of these people have completely normal memory and thinking. The images simply don't match reality. I've personally seen people sharp as a tack, reading books, managing finances, and their MRI looks alarming, while people with early dementia sometimes show fairly normal scans. So what should you do instead? There's a far better approach. Simple office tests taking just 10 minutes, remembering 3 words, drawing a clock, counting backward from 100 by sevens, measuring how your brain actually functions rather than merely how it looks in an image. If those tests reveal genuine problems, we then search for causes, and most memory issues in older adults turn out reversible. Perhaps a medication causing fogginess, low B12 levels, undiagnosed depression, sleep apnea cutting oxygen at night, or an underactive thyroid. We check all of these first, and fixing just one often brings memory right back, no MRI required, because we're treating the person, not merely the picture. Now for the third test, and this one surprises people because it seems entirely logical. Stress tests for your heart, specifically placing someone on a treadmill purely because they've reached a certain age. Picture being 72 and heading in for routine surgery, maybe a hernia repair or knee replacement, and hospital protocol demands everyone over 70 get a cardiac stress test first. Even though you feel great, even though you regularly walk 2 miles without chest pain or shortness of breath, you're put on that treadmill anyway. Think about it. If you already walk 2 miles daily without issue, what exactly will the treadmill reveal that your daily life hasn't already proven? Your life is already your stress test, and you're passing it every single day. But protocol is protocol, so you comply, and here's where problems emerge. Stress tests carry remarkably high false positive rates in older adults, meaning the test flags something wrong when nothing actually is, possibly because your heart rate doesn't climb like it once did, or because of medications you're taking, countless reasons unrelated to any dangerous blockage. Once that test comes back abnormal, though, you're on the medical conveyor belt. A cardiac catheterization gets scheduled, threading a tube through an artery straight to your heart, an invasive procedure carrying genuine risk. Often they find exactly what you'd expect in a 72-year-old heart, some plaque, some narrowing, nothing requiring stents or surgery, nothing about to cause a heart attack. But now you've endured an invasive procedure and been permanently labeled a heart patient, placed on new medications, and psychologically shaken, perhaps too afraid to exert yourself the way you used to. The test meant to protect you has instead stolen your confidence. So what's the alternative? Listen to your body, the best stress test available. If you can climb stairs, walk briskly, handle normal activities without chest discomfort or unusual breathlessness, your heart is telling you it's doing fine. Watch for real warning signs instead: chest discomfort during exertion, unusual shortness of breath, dizziness, and if those appear, absolutely get checked. But if you want to understand future risk, there's a far better tool: a coronary calcium score, a quick 5-minute CT scan with no treadmill, no needles, minimal radiation, measuring calcium buildup in your arteries. A 0 score means very low heart attack risk for years ahead. A high score means getting serious about prevention through diet, exercise, and possibly medication. The key difference is this score guides prevention without automatically launching you into invasive procedures, giving you information to make real choices rather than anxiety forcing your hand. Finally, colonoscopies after 75 deserve the same scrutiny, especially routine screenings when previous results were normal with no special risk factors, since perforation risk roughly doubles or triples past 75, and if life expectancy is under 10 years, the math simply doesn't favor continued screening. Watch for symptoms instead and eat more fiber. If this changed how you think about testing, share it, subscribe, and tell me below whether you've ever felt pushed into a test that didn't feel right.